Hello, and welcome to this edition of Bioethics Update, a service of the Center for Practical Bioethics. My name is Trudy Galblum, and I work in marketing and communications at the center. Today, I'm here with my colleagues, Linda Ward, Cindy Leyland, Monica Dellis, Matthew Piecha, and Jan Evans. Today, we're going to talk about Medicaid expansion in Missouri. Missouri is one of only 14 states in America where residents pay federal taxes that fund Medicaid, but currently receive no benefit. Right now in Missouri, a family of 4 must earn $5,500 or less to qualify for Medicaid, and single adults don't qualify at all. Consequently, more than 230,000 Missourians make too much for Medicaid and too little to afford health insurance. Since COVID-19, many of the more than 500,000 Missouri workers who have filed for unemployment have lost their health insurance. So on August 4th, Missouri voters will decide the fate of Amendment 2. Amendment 2 asks them to vote yes or no whether or not to adopt Medicaid expansion for persons ages 19 to 64 with incomes at or below 133% of the federal poverty level. Medicaid expansion in Missouri would mean that individuals making up to $18,000 a year and families of 3 making $30,000 a year would be eligible for Medicaid. So what I want to do here today is ask my colleagues at the center who are Missouri residents why they personally support Medicaid expansion. And Linda, I'm going to start with you. I believe you have a family perspective to share.
Thanks, Trudy. I've always been puzzled by why Missourians like us are paying into a program we don't benefit from. And the other thing is just this extraordinarily low threshold or high threshold to be eligible has always been a puzzle to me. And those of us on this call are fortunate to have access to health insurance, and so many people are not. Even in my own family, there have been situations where due to a loss of a job or a change in status, it's very, very difficult to get health care when you don't have access to it. And this is one step in the right direction. I'm delighted to vote yes on 2.
Excellent. Cindy, you too have a little bit of a personal perspective on this.
Absolutely, Trudy. I grew up poor. We were on government assistance. It was known as AFDC, Aid to Families with Dependent Children, all those years ago. We used paper food stamps, which meant that everybody in line behind you knew that you were on food stamps, which invited their judgment and their nasty comments. And we were on Medicaid. And a defining moment in my life was when I was in the dental chair with an impacted wisdom tooth, and the dental hygienist made an ugly, disparaging remark about the stupid Medicaid patients, and I couldn't respond. And I determined then and there that as an adult, I would never be on Medicaid, and I would do everything I could to educate others about why Medicaid is so important. It's important for children, it's important for families, and it's important for our nation. It's important that we have safety nets in place for people who can't help the situations they find themselves in. Medicaid eligibility is based on the federal poverty guideline. That was developed in 1963, and it's based on the cost of the minimum food diet for a family of 3, for a family of various sizes, and then multiplied by 3. That was in 1963. They still use that same calculation. They've updated it to account for today's food prices, but there's no recognition of how much it costs to educate children, how much it costs to have shelter, transportation, education. None of those costs are included. But those are just numbers. It doesn't take into account the lives that are impacted. One of my heroes and one of the persons who helped shape my the way that I think about social policy was Michael Harrington. Michael Harrington wrote The Other America. And in the conclusion to The Other America, he wrote, until these facts, these numbers shame us, until they stir us to action, the other America, the America of poverty, will continue to exist, a monstrous example of needless suffering in the most advanced society in the world. Until we can be shamed into doing something, this is what's going to exist. We can and we should do better. We need to vote yes on expanding Medicaid in Missouri.
Great, Cindy. That was really heartfelt. Jan, you're an accountant. You're our CPA. You're going to talk to us a little bit about benefits to Missouri and its people.
Right. Thank you, Trudy. Missouri, like Trudy mentioned, is one of the states that has not expanded Medicaid. So far, 37 states plus Washington, D.C. have already expanded Medicaid. Oklahoma just expanded in June, so they really don't have a history yet. But of all the states that have expanded Medicaid, they've chosen to keep the program in place in a large part because of the positive economic influence on their state. With Medicaid expansion, 90% of the cost of expansion is paid by the federal government. And also with Medicaid expansion, the state would receive higher federal reimbursement rates for existing Medicaid recipients. Now, I think like Linda mentioned, these are federal tax dollars that Missourians have paid. And these are dollars that would then come back to the state of Missouri. So the increased federal funds that would flow back to Missouri would produce budget savings here in Missouri. That would allow Missouri to reallocate their state funds to go towards other priorities. The Missouri State Auditor did issue a report that estimated that the savings to Missouri with Medicaid expansion is up to $1 billion a year. So that is significant for Missouri. But really, as you mentioned, Trudy, the positive impact of Medicaid expansion goes well beyond the budget. There are approximately 230,000 Missourians that could benefit from Medicaid expansion. So Medicaid expansion is good for the state of Missouri, but it's really good for Missourians.
Perfect. That's great. Thank you, Jan. Monica, I understand you're going to share a little bit of your thoughts about the impact of Medicaid expansion on rural healthcare.
Yes, thank you, Trudy. Well, a few weeks ago, we received a phone call from a doctor in rural West Virginia who had just been laid off from a local rural hospital that closed, leaving local residents to travel a half hour, she said, to the nearest emergency room. And that also left, she said, patients that need emergency medical health care in her community to travel a whole 2 hours to get the care they needed. Rural Missourians need health care in their communities, and access to rural health care can be life and death. By voting yes on August 4th, we can reduce uncompensated care costs for rural hospitals by 31%. That's huge to the rural hospitals. That can easily be the difference between life and death for our rural hospitals. So we need to vote yes.
Thank you, Monica. And Matthew, you're a deep thinker. What's your take on this?
I think that one of the characterizing features of healthcare in the United States is that it's a patchwork. We have a lot of different programs that are sort of divided up amongst the state level and federal level, And it's really up to everyone to figure out how to knit all of that together and make sure that that people get health care. I think the other characterizing feature of healthcare writ large is that no matter what, you end up paying for it. So even if if the state is not, paying to cover the healthcare for these folks, as Monica mentioned, that ends up being uncompensated care that is provided by these rural hospitals. A lot of times that can be extremely burdensome to their continued operation. That means that it endangers the jobs that those hospitals provide. It also means that the people who can't get access to care end up waiting longer before they end up going to a hospital, and that a lot of times means that their care ends up being more expensive. So no matter what, those costs, they just get pushed around, right? And so you have to really be deliberate about the way that you solve these problems. Medicaid expansion is one of the ways that we can kind of close some of the gaps in this patchwork of healthcare systems that we have in the United States and Missouri specifically, and that it's that close to 250,000 Missourians who fall inside of that gap who need coverage. So I think it's really important for us to be deliberate about this, and we have a chance as Missouri voters to make our own voices heard, which I think is it's a unique opportunity for Missourians. We're lucky in that we have this ballot initiative mode that we can make our voices heard directly, and so I think it's really critical that we take this opportunity to do it and vote yes on Amendment 2.
Great, thanks, Matthew. And thank you to all of you for sharing your perspectives and your stories. I hope we've convinced a few listeners, a few voters, why it's important to vote yes on Amendment 2. And I want to thank everyone for joining us for this bioethics update. Don't forget, you can subscribe to all of our updates and the Center for Practical Bioethics YouTube channel. And you can receive ethics updates emails at practicalbioethics.org. So thanks again for joining us. Be safe, be well, wear a mask, and vote yes on 2. Thank you.